My name is Isah Aljaninat, and I will be presenting on a project paper on rather to evaluate the incidence and behavioral risk of HIV infection among patients of age group 15 to 49 years who visit the primary healthcare center between January to December. Uh, Summary: HIV is present in both free virus and particles within infected immune cells. Modern HIV testing is extremely accurate, and screening has been inculcated in normal clinical diagnosis, whereby a patient visits the healthcare facilities and after probably the clinician sees the patient, other tests are being ticked, and as well the HIV testing. HIV testing has been, it's okay, this was a community service because there were some approaches that were noticed in the area, in the community. Patients who came for treatment, for other treatment like malaria, typhoid, did not want to access HIV care. They did not want to get counseled, neither did they want to get tested. So it was more like a social behavioral approach to give back to the community The patients were analyzed as they come from the beginning of the year to the end of the year, the total number of patients that visited the facility, and these numbers were supposed to be used to give back a concrete evidence back to stakeholders, to give back to the village head on the importance of HIV testing. So that was what I meant by it was a community service, to reach out to community, to enlighten and educate them about HIV burden from high-risk behaviors in the environment. And this research uses a behavioral approach from the community and also to reduce stigmatization from HIV-infected or related illnesses to reduce morbidity. So what's next? Measuring up on the incidence of HIV infection in the community gives an exact ranking of the illness in that geographical area, that's within the Karu local government, and it is important in health promotion, education, and screening. It's a primary prevention strategy. We know from what we have learned from epidemiology, from health promotions, about the importance of screening, which is a primary prevention strategy, which is just the tip of the iceberg because HIV, once it affects an individual, it compromises the immune response. So the tip of the iceberg is just you getting to know the patient's HIV status and sending the patients further for treatment. The research brought about some sense of belonging to the community, behavioral changes were made, and also hindrances from accepting to get counseled and tested was reduced. Positive HIV patients can now disclose sexual contact and also disclose to their family members who may be infected or even their partners. Okay, increase in health and also to increase the health of the general population. The background of the study: HIV is a sexually transmitted infection. Non-sexual transmission occurs from infected mother, that's a probably high risk mother, which came for antenatal and were tested and they found out their HIV status. Okay, so there's a transmission between the mother and the child. That's if the HIV status was not detected early enough during the antenatal process. So the aim of the study was to evaluate the incidence of HIV infection at the particular ward, that's Karu ward, between January and December 2017. And also we needed to identify behavioral risk factors that had led to them contacting this infection within that geographical area. The total facility attendance for the 12-month period was 9,823 patients who visited the facility. The daily attendance was gotten from the register in the facility, and out of the 9,823 patients who visited the facility within the 12-month period, 8,624 patients were tested, and among those tested, 6,722 fell between the age band of 15 to 49 years old, where we have the high incidence of HIV infection within the community. Statistics showed that females had higher risk to HIV infection. So what methods did we use in order to analyze this data? The research is a qualitative retrospective study. It was done last year from January to December, and the total facility attendance was compared to the total HIV testing that was carried out. Comparison was carried out between the two age bands. That's okay, the total number of people who came to the facility from less than 1 year to 50 years above were about the 9,600, which was initially mentioned. That's 9,823 patients, and the 6,722 patients were tested fell between the age band of 15 to 49 years old. So the results from the analysis, the males the male positivity yield between 1 to 50 years old fell. We had 17 positives. But the initial age band, which we are actually looking out for, it's 15 to 49. And we had 13 males which turned out reactive, that's positive. And they had a positivity yield of 76.47%, while the female positivity yield was 77, the total general population. But between age 15 to 49, we had 54 yield, giving us to 70.13 positivity yield from the total positives of the year. In conclusion, youth, that's male and female, have high risk of contacting the virus. Young women are at higher risk of HIV infection than men. HIV testing is the first 90 of the CDC vision of 90-90-90 goal for PEPFAR implementation, whereby they say that 90% of the total population in the community must be tested. They should know their status. 90% of those who know their status and 90% of those who were tested who knows their status must be placed on treatment. And 90% of those who have been tested who knows their status who have been placed on treatment must attain viral suppression. So it's just as if we're trying to have an epidemiological control over HIV. So most of the behavioral risk factors that we got were mostly from postpartum sexual abstinence during when the wife is pregnant and the man goes out. Those acts bring risk to high HIV infection in the community. HIV epidemic was more driven by high risk behaviors like injection drug users. We had about we had about 7 patients who were tested positive. Then we had men who had sex with other men. We had multiple sexual partners from extramarital affairs. We have multiple wives, cases of divorce and reconciliation, and we had other reactive patients, that's positive patients who were immunocompromised, and we had other patients from female sex workers. Nigeria is the second largest group, or rather country, with people living with HIV, and there was a gap compared with the total facility daily attendance and the total HIV testing in the facility. About 12.2% of the people who visited the facility was not tested due to religious belief, self-refusal, and cultural belief. So this data was used to showcase in the meeting. It was actually a social behavioral approach that was used. It was used to focus to the stakeholders, to the community heads, and the service chiefs in the community to show the reason why HIV testing is important. And it also showed risk factors which led to most of the communities having this infection. So we're looking into the future. We're saying HIV contact tracing from sexual partners, those who were found reactive, those who were positive, they will be able to identify each of their sexual contacts to help to reduce the rate of the incidence of the infection. Then TB, that's tuberculosis patients susceptible to HIV infection in low immune response from malnutrition, because malnutrition is common in the environment, which is a susceptible factor to immunocompromised system, which can lead to one contacting HIV. From what we learned in public health nutrition is very important. So malnutrition is common in the community and in slums that are very congested. Thank you.
If there is no question, we'll move ahead with polling session. And kindly note down Ms. Aisha email ID for getting their advice or queries or suggestions. You can share each other. And now we are moving to polling session. So dear participants, please poll for Ms. Isha. So here we are ending the polling session for Ms. Isha.